If you've ever binged The Pit or Grey's Anatomy, or yes, even ER, our next speaker is for you. Why do you write it that way? Or even ER? Is it basically saying, like, if you recognize that, you're old? That's basically what it's saying. That's why it's written that way. Dr. Abbas Ardehali, professor of surgery and medicine at the David Geffen School of Medicine, isn't here to tell us about makeshift breathing tubes or elevator romances, but I assure you, his work is just as dramatic. Dr. Ardehali works with organ transplants. In fact, he and his team have revolutionized the field by creating a way to keep hearts and lungs alive and working outside of a human body. He's the first surgeon in the United States to ever perform a transplant using one of these techniques. And his first patient, Fernando Padilla, a carpenter, who helped build our Ronald Reagan UCLA Medical Center, the very hospital where his life was saved by a breathing organ. Incredible, right? Please help me welcome to the stage Professor of Surgery and Medicine, Dr. Abbas Ardehali.
Is my mic on? Yes. It's wonderful to be here with you this afternoon. It was about 57 years ago that the first human heart transplant was performed in Cape Town, South Africa. This is the front page of the local newspaper about 7 or 8 days later. It has many things that we now consider violation of patient privacy and HIPAA. Front and center, you see actually the picture of the patient and his wife. Right below that, you see the picture of two individuals who received the kidneys from this donor. And most strikingly, you see the picture of the donor to your left side, a 29-year-old woman who was involved in a motor vehicle accident and was the donor. Right below that, at the bottom, you see a surgeon, the heart transplant surgeon, smiling. Well, over the past 50-some years, many things have changed, but two things have not. One is that we just don't have enough donor organs. At any given time in this country, we have over 100,000 patients waiting for a life-saving organ transplant. The second thing is that we have limited time from the time that we take the donor organ to the time that we actually transplant it into the recipient. For hearts, it's somewhere between 4 to 6 hours. Beyond 6 hours, the heart may not just work. When we get a donor offer at any hospital in California or beyond, we send a team out. They rush to the donor hospital, they stop the donor organs, and put them on ice, and carry them here to UCLA or at any recipient hospital using an igloo cooler, a cooler that you can get at any local hardware store. And when the heart comes here, it is in a bag of ice with a lot of slush. And when they hand it to us, it's actually frozen. A human heart that is frozen during transport. Well, several decades ago, some of us began asking the question, there must be a better way that we can preserve human organs for transplantation rather than freezing them. What if we could actually take the donor blood, put it on a circuit, put the human organ in the circuit, and have the blood circulate through the organ? As far as the donor organ is concerned, it's still in the donor body because it's doing what it does. A human heart in this machine continues to pump, it's beating, the human lung continues to breathe, the human liver continues to produce bile, and of course the kidney makes urine. This is a device that's portable. It houses the heart, and when the heart is on it, it continues to beat just like a normal human heart. In fact, this is one of the earliest hearts that we have ever done with this technology on a patient about about 12 years ago, and this heart, it's still beating in somebody's chest in Southern California. The pivotal study that showed that this technology is safe and it works was this study that's pioneered at UCLA that subsequently led to the FDA approval of this technology, now being a common practice throughout the country. When it comes to the lung, it continues to breathe on the machine. There is blood circulating through it. We actually have access to the airway. We can actually go in there and clean out the airway so that we have a better lung for transplantation. The first lung, as you already heard, was transplanted here at UCLA. Although this technology has been transformational, there are issues with it. As you can imagine, this technology keeps the donor organ on a device with the same blood circulating through it for hours and hours. So toxic metabolites build up in the circuit. There is no kidney associated or liver associated with it, and therefore it doesn't clear the circuit. So about 2 years ago, we asked the question, what can we do to make this a better circuit? What if we could actually connect the recipient's blood to the organ so that the organ gets repaired and resuscitated using the recipient's blood before we actually transplant it? You can think of it as a test drive, that we actually test the organ before we transplant it. In fact, we did the first experiment about 2 weeks ago with promising results, and we're now working with the FDA to be the first center in the world to use this technology using the recipient's own blood to resuscitate the donor organ before we open their chest, before we open their abdomen. So stay tuned. There is more coming. What are the potential applications of this technology? We already talked about the fact that we can keep the human organs alive for hours and even days. The longest that a human heart has been kept alive on this device was over 26 hours in Kazakhstan, believe it or not. The other way that this technology can help improve things is that it can potentially expand the donor pool. As I mentioned, there are thousands of patients waiting for donor organs. We just don't have enough donors. But we can potentially put a donor organ that has a condition and then treat it and expand the donor pool. For example, a donor lung that has pneumonia, we can put it on the machine, treat it with very high doses of antibiotics, and treat the infection before we actually transplant the donor organ. So potentially expand the donor pool substantially. But what is most exciting to me, what keeps me working every day, waking up every morning with excitement, is the fact that we can potentially engineer better organs in the future. We can take an organ, make some changes in it, and make it a better organ for transplantation. An example. Many of you know that O blood type individuals are universal donors. They can donate to everyone. But O blood type individuals are very difficult to find an organ for. In fact, right now we have tens of patients waiting in our ICUs at Ronald Reagan, UCLA, waiting for O donor blood type organs. We and others have shown that we can actually convert an A blood type or a B blood type on this platform to an O donor. Imagine having abundant and limitless number of universal donor organs. And most excitingly, the possibility of creating an organ that is no longer considered foreign, an organ that cannot be rejected. As you know, each of us have our proteins on their body that are unique to each of us. When an organ gets transplanted, we have to treat the recipients with medications called immunosuppressive medications. And if we can create an organ that is no longer expressing those proteins, it's possible that transplantation can occur without immunosuppression. Over the past 4 or 5 decades, UCLA has been a major force in advancement of science, medicine, and specifically in organ transplantation. Did you know that UCLA has done more organ transplant than any other hospital, medical center, or health system in the United States since 1988, when the Department of Health and Human Services began counting numbers? Did you know that the standard of treatment for heart transplants that is now widely practiced throughout the world, any patient who gets a heart transplant gets treated with these medications? They were developed and tested and proven at UCLA. Did you know that UCLA has the largest experience for patients who have undergone lung transplantation and also heart surgery at the same time? These are the patients that would not be candidates anywhere. But at UCLA, we have the largest experience of that. UCLA has done more than 8,000 liver transplants. Did you know that you can actually get a kidney transplant at UCLA and a year later you would be free of immunosuppression? UCLA is the only one. Did you know that UCLA did the first bladder transplant in the world? Some of you may know because this was all over the news the past month or so. Well, let's fast forward to 10 years from now, June of 2035. A patient who has end-stage organ disease through no fault of their own, probably because of a genetic condition or an exposure to an agent that was outside of their control, needs an organ transplant. They actually schedule the organ transplant on a certain day at Ronald Reagan UCLA Medical Center. They come to the hospital, which, by the way, still has a banner that says #1 in Los Angeles, #1 in California, but in 2035, #1 in the country. This individual goes to the operating room. On the way, they may actually see their organ in an ICU, which is being perfected, engineered, tailored to that specific recipient. Talking about ultimate precision medicine. This individual undergoes his or her organ transplant. Several days later, they walk out of Ronald Reagan UCLA Medical Center with little or no immunosuppression. Truly a second chance in life. Well, over the past several decades, UCLA has been a major force in advances in science, medicine, and organ transplantation. But I submit to you, the best is yet to come. It's indeed a truly exciting and remarkable time for us as a Bruin community. Thank you.